Hello, I'm Dr. Amanda Dinsmore. I'm an emergency physician. I've been practicing for, I don't know, since 2003 when I finished residency, and I'm currently working in Springfield, Missouri.
Hi, I'm Dr. Laura Kazir. I'm also a board certified emergency physician. I finished residency in 2003. Amanda and I were in the same class, and I've been practicing in Huntsville, Alabama for the past 16 years.
Hi, I'm Dr. Kendra Morrison, and I'm also an emergency medicine physician. I've been practicing for about 15 years, and I too live in Springfield, Missouri.
And today we're going to talk to you about the case for physician coaching and why coaching for us as physicians can help us achieve our best lives.
So first, let's talk about the problem.
So burnout by definition is the feeling of being overextended and depleted of one's emotional and physical resources, which I'm sure everyone can identify at some point in their lives or careers. The statistics that you see on the screen have definitely struck a chord, not only in society, but as female physicians as a whole. We do feel the pressure of burnout more so because we don't ever get to clock out. We go to work and feel the weight of the responsibilities at work, and then when we go home, we have just as many or more responsibilities with kids and home life, and so we are reluctant to get help, therefore leading to a secret suffering. And as you can see, that female doctors have significantly higher risk of suicide compared to other female professionals.
So the good news is that we have multiple solutions, and coaching is one of those very powerful solutions to help us to process our feelings, our thoughts, and achieve results beyond what we have ever imagined or hoped for.
So we're doctors, so we like data. And the good news is that there's two randomized trials that have come out in the past few years proving that coaching can actually be very good for physicians. The first one is the Mayo Clinic study from 2019. In this study, there were 40 people in the intervention group that got coaching and then 40 in a wait list. They had 6 coaching sessions that discussed a variety of topics listed there, and they were able to show a statistically significant improvement in emotional exhaustion, burnout, resilience, and quality of life. In 2020, a McLean Hospital study came out, same intervention, 6 sessions of coaching. This time there were 29 in the intervention arm and 30 in the control group. And it also showed improvement in burnout. This one showed improvement in work engagement, psychological capital, and job satisfaction. The fascinating thing about this one was that they did a 6-month follow-up, and these results were sustained.
So let's have a little bit of discussion about what coaching is. Ladies?
So to me, coaching is, it's not the same as therapy. It's not psychiatry. It's actually not even a mental health. You're not considered a mental health specialist. It is somebody who is objectively helping you look at your thoughts. Because while pain is inevitable in our lives, what I have found through coaching is that a large portion of the suffering that I was experiencing was optional. And coaching is what helps you, especially causal coaching. That's the kind of coaching that Laura and I are trained in. There's some coaching that gives you a list of things to do. Well, we are physicians, okay? We're pretty smart, and most of us know what to do, but we're not doing it anyway. And that's the fascinating part of looking at what your thoughts are that are giving you the results that you're experiencing in your life.
Yeah, exactly. I like to think about coaching as being future focused as opposed to past focused, where in therapy, we might look at things that have happened in the past to us and try to make sense of those. In coaching, we're looking to the future and creating amazing things for ourselves by changing the way we think and feel about our current circumstances. And it's kind of magical. It's amazing.
It is magic.
So how is this a little bit different?
So again, like I talked about, it is not you're not a mental health specialist. So for instance, a lot of the studies suggest that physicians are very reluctant to get help and support. Some of it is like just even people where I work, they don't want something in the electronic medical record that somebody could stumble upon, or maybe they want to talk about their employer. Well, they're not going to want a chart in their employer's, even though it should be private. The other thing about coaching is that it's stigma free. I mean, business CEOs have had mindset coaches for years. And why? Because it's helpful. You have to have a different mindset to be a high achieving person. And so anyway, I just love that it's stigma free. And if a business CEO benefits immeasurably from it, then why in the world why don't we have the same thing available to us? The good news is that this is a new thing and it is taking off quite a bit.
Yeah. There are so many times where I could have benefited from just being able to talk through. It's kind of like when you're on shift and you're there with another person instead of being on shift solo, where you can kind of talk through cases and bounce ideas off someone. And, am I crazy thinking this, or am I doing the right thing? It's kind of like that for our lives, where we, coaching, when I talk to a coach, that person is helping me stay in touch with reality and see, separate what's fact from fiction and help me to achieve what I want to achieve and not let me keep myself stuck in situations I don't want to be in.
Well, that's great and all, but ladies, how can it help us as female physicians?
So I'll just speak to some of my own clients who are incredible doctors, but this is something that has come up multiple times where they miss something on an x-ray. And yes, it's something that you would have rather not missed, but the self-criticism and the spinning that happened after that, nothing even bad happened to the patient. It could have, but it didn't. And bless my clients' hearts, they were just so down on themselves that they could have hurt somebody. And what we were able to look at is that, first of all, it's impossible to be perfect. We are still human. They are excellent. And so sometimes it is a much healthier, a much more useful thing to shoot for excellence, knowing that you can't be perfect. Because when they were criticizing themselves for this thing that didn't even ultimately make a difference, it didn't help them get any better. It makes you think, I mean, it seems useful, but it wasn't. It was making them miserable. It wasn't helping them learn the lesson. It was making them overthink and second guess themselves all the time. Whereas if we can start shooting for being excellent instead of perfect, then you know what? I almost missed this. And you know what? I'll never miss this again. And so because of this, they're actually better doctors.
Yeah. The question is, how can it help? Well, it can help really just about any problem that we have. Coaching can help us develop a mindset to approach that problem in a way that will provide results for us that we want. So it's, like I said, it's just awesome. Such a great, great tool to have.
Magic.
So there's here's just a list of some of the things that we have used we've addressed in coaching with clients, and seem to be things that come up over and over again. Imposter syndrome is a huge one, especially with physicians. Perfectionism, we are all very high achieving people, and perfectionism is a common issue for us. Burnout, we can help in relationships, help us to develop relationships that bring us fulfillment and joy, regardless of what the circumstances are. Help us with time management, getting those charts done and leaving on time. Can help us to take care of ourselves so that we can be good examples for our kids, our families, and our patients. We can learn how to have a healthy relationship with money and learn how to create our best lives and really just more of all the things that we want in our lives.
So while coaching helps most things, there are sometimes when coaching isn't appropriate. Again, we are not mental health professionals, and also we are mandatory reporters as physicians. So in a condition like domestic violence, anxiety, depression, making it hard to attend to your activities of daily living, struggling with the will to live, or being homicidal as well, processing big traumas, that acute phase, and then special, like that would be better dealt with a therapist or psychiatrist. The same thing with special techniques like EMDR. We would love to work with you after, but those things are better managed by a mental health professional.
So we know that as physicians, you are very intelligent with very powerful minds. So coaching has helped to optimize mind, body, spirit, and soul to restore your joy, contentment, and excitement. We know that this is a whole person wellness, and no one else is going to initiate or go for it except you. It's time for your reset and your restoration. Your brain is very dynamic and plastic, and we want to help you create the life you want in a way that makes sense for you.
So why us? Who are we anyway? We are you. We are 3 board certified emergency physicians. We understand the specific issues that women physicians deal with. And I know for me personally, there's a lot of times I just want to talk to another doctor. Only doctors understand what we go through and what we've been through. So
yeah. And for us anyway, people keep asking more and more of us, see more patients, see them faster, do this metric, do that metric. We just feel like it's time for somebody to start looking out for the healers themselves. It is our mission to help heal the healers. How are you going to pour out of an empty cup? And so our goal is to help fill your cup so that you have more to give.
And part of that mission is that we understand about giving back. So 10% of the profits that we make go back to charitable organizations.
So to wrap this up, I just cannot bear for our people to go on miserable. And so we put together, based on our clients and what we've learned through coaching, our top 10 burnout busters for doctors. And we would love to share that with you for free. Just go to our website there, thewholephysician.com, and please read it and let us know if it doesn't help just even slightly.
Yeah, we can't wait to get to know you and help you to live in a way that is true to you and that will bring you the most joy and satisfaction just by raising your awareness of the way your mind is taking you different places and giving you the results that you're getting.
Can't wait to work with you.
Bye, guys.